When people think of high cholesterol, they often associate it with silent changes happening inside the body, such as plaque buildup in the arteries or an increased risk of heart attack and stroke. What many do not realize is that cholesterol-related problems often reveal themselves in very subtle physical ways, particularly while walking. One of the most common but overlooked warning signs is leg pain, also known as claudication. This pain often appears when someone is walking or exercising and usually goes away when they stop and rest. The discomfort may start as a dull ache in the calves, thighs, or buttocks, and some people describe it as cramping, heaviness, or burning in the legs. It may not seem serious at first, but this symptom is an important clue that cholesterol buildup may be restricting blood flow to the lower limbs. High cholesterol leads to the gradual narrowing of arteries, a condition known as atherosclerosis. When cholesterol particles and other fatty substances accumulate along the arterial walls, they form plaques that harden over time. These plaques make the arteries stiff and narrow, limiting the oxygen-rich blood supply to muscles. While walking, the muscles demand more oxygen to sustain the activity, but narrowed arteries cannot deliver enough blood. As a result, the legs experience pain, cramping, or weakness. The discomfort typically eases with rest because the demand for oxygen decreases, and the limited blood supply can temporarily meet the body's needs. This cycle of pain during activity and relief during rest is a hallmark of peripheral artery disease, which is often linked directly to high cholesterol levels. It is important not to dismiss leg pain while walking as a sign of aging or fatigue. Many individuals assume their muscles are simply tired, or they blame joint problems. However, if the pain occurs consistently at the same walking distance or level of exertion and improves with rest, it is often a red flag. Left unchecked, blocked arteries in the legs can progress to severe complications, such as non-healing wounds, infections, or even gangrene, which may ultimately lead to amputation. Furthermore, leg pain from blocked arteries is not just a localized issue, it is often a signal that similar blockages could be present in the coronary arteries of the heart or the arteries leading to the brain. This means that leg pain during walking can also indicate a higher risk of heart attack or stroke. Addressing this symptom involves both medical evaluation and lifestyle changes. Doctors often use tests like the ankle brachial index, ultrasound, or angiography to determine the severity of arterial blockages. Treatment may include cholesterol-lowering medications, blood thinners, or procedures to restore blood flow. Equally important is adopting healthier habits, such as reducing saturated fats in the diet, quitting smoking, and engaging in regular exercise under medical supervision. Recognizing leg pain is more than just fatigue can save lives by catching cholesterol-related issues before they escalate into emergencies. Another subtle yet telling symptom of dangerous cholesterol levels during walking is numbness or tingling in the feet. Unlike leg pain, which is often described as cramping or aching, numbness is a sensation of pins and needles or a loss of feeling altogether. This happens because high cholesterol damages blood vessels and reduces circulation to the extremities, a condition often tied to peripheral artery disease. When arteries are clogged with cholesterol plaques, the nerves in the feet and legs receive less oxygen and nutrients. Over time, this poor circulation irritates the nerves, causing sensations of tingling, burning, or numbness. Walking increases the body's need for blood flow, but the restricted vessels cannot keep up, so these unusual sensations become more noticeable. At first, numbness in the feet may come and go, often triggered by longer periods of activity. Some people dismiss it as a minor annoyance or attribute it to uncomfortable shoes. However, recurring numbness should never be ignored. If the nerves in the feet are deprived of oxygen for too long, they can suffer permanent damage, leading to neuropathy. This makes the feet more vulnerable to injuries and infections, as individuals may not feel pain or pressure properly. For example, a blister or small cut on the foot may go unnoticed and worsen over time, potentially developing into a serious infection. In severe cases, poor blood flow combined with nerve damage can lead to ulcers, gangrene, and even the need for amputation. Beyond the feet, numbness also points to wider systemic risks. The same cholesterol buildup causing nerve issues in the legs can affect arteries supplying the heart or brain. This means that foot numbness during walking is not just an inconvenience but also a warning of possible heart attack or stroke in the future. Early medical attention is crucial to determine whether high cholesterol and blocked arteries are the underlying cause. Treatment often involves managing cholesterol aggressively through medication, diet, and lifestyle adjustments. Walking itself, under proper guidance, can help improve circulation by encouraging the growth of small collateral blood vessels. However, without addressing cholesterol levels, the numbness and tingling will likely worsen. Paying attention to the feet and recognizing unusual sensations is essential. Our bodies often whisper before they scream, and numbness is one of those whispers telling us that cholesterol may be silently causing damage inside. Another symptom that can reveal dangerously high cholesterol levels while walking is the sensation of cold feet. Many people shrug off cold feet as something related to room temperature, poor footwear, or even stress. While those can certainly play a role, persistently cold feet, especially when they occur during walking or activity, can be a strong indicator of poor circulation caused by blocked arteries. Cholesterol buildup within blood vessels gradually narrows their pathways, reducing the amount of oxygen-rich blood that can reach the extremities. Since the feet are the farthest point from the heart, they are among the first areas to show signs of insufficient blood flow. When walking, the body demands an increase in circulation, especially in the legs and feet. Healthy arteries should expand and supply the additional blood needed. However, in individuals with atherosclerosis due to high cholesterol, this does not happen efficiently. Instead, the feet may feel unusually cold compared to the rest of the body. In some cases, one foot may feel colder than the other, reflecting uneven plaque buildup in the arteries. What makes this symptom particularly concerning is that cold feet often develop silently over time, which means cholesterol has likely been accumulating in the arteries for years. Cold feet during walking are not merely a discomfort but a warning that tissues in the extremities may not be receiving adequate oxygen. If left unaddressed, this poor circulation can impair the health of muscles, skin, and nerves. Over time, this could lead to tissue damage, infections, or ulcers that are slow to heal. In severe cases, the reduced blood flow can result in critical limb ischemia, a condition where the extremities are at risk of gangrene and amputation. This risk is compounded by the fact that individuals with circulation problems in the legs and feet almost always have similar issues in the coronary arteries, making them more vulnerable to heart attacks. Unfortunately, many people ignore cold feet because they seem like a minor inconvenience rather than a serious medical issue. However, when this symptom appears during walking and persists even after activity, it should not be dismissed. Doctors can perform simple non-invasive tests to check circulation, such as measuring the ankle brachial index or using ultrasound to examine blood flow in the arteries. Treatments often focus on reducing cholesterol through diet and medication, improving circulation through supervised exercise, and sometimes performing procedures to restore blood flow. Taking cold feet seriously can mean the difference between catching high cholesterol early and facing life-threatening consequences later. Another walking-related symptom of high cholesterol that deserves careful attention is swelling in the ankles and legs. At first, swelling may appear to be related to long hours of standing, minor injuries, or even heat. But when swelling happens consistently during or after walking, it could be a sign of poor circulation linked to dangerous cholesterol levels. Swelling, medically referred to as edema, occurs when fluid builds up in the tissues. One of the reasons this happens is that cholesterol-induced plaque narrows the arteries, reducing the efficiency of blood flow back to the heart. As circulation weakens, fluid begins to leak into the surrounding tissues, causing puffiness and heaviness in the ankles and lower legs. Walking often makes this symptom more noticeable because the activity increases blood flow demands. If the arteries cannot keep up due to cholesterol buildup, the legs may swell more quickly. This swelling can be mild in the beginning, perhaps only noticeable as a tighter fit in shoes or socks, leaving deep marks around the ankles. Over time, however, the swelling can become more pronounced, uncomfortable, and even painful. The skin may feel stretched, tender, or shiny, and in severe cases, the swelling may extend up the calves. Swelling in the legs and ankles is more than just a cosmetic or comfort issue. It is an indication that the cardiovascular system is struggling. Poor circulation due to high cholesterol puts additional strain on the veins and heart, making it harder to pump blood efficiently. Left untreated, this swelling can lead to complications such as skin ulcers, infections, and reduced mobility. In advanced cases, it may even suggest heart failure, since cholesterol-related arterial blockages do not only affect the legs but also increase pressure on the heart. One of the challenges with swelling as a symptom is that it has many potential causes, ranging from dietary salt intake to kidney problems. However, when it appears alongside other walking-related symptoms like leg pain, numbness, or cold feet, it strongly suggests a link to cholesterol-related circulation problems. Medical evaluation is essential to determine whether cholesterol and plaque buildup are the underlying cause. Addressing swelling requires a combination of medical and lifestyle approaches. Doctors may recommend cholesterol-lowering drugs, blood pressure medications, or diuretics to reduce fluid buildup. Lifestyle changes such as reducing sodium intake, elevating the legs after walking, and maintaining a healthy weight can also help manage swelling. Most importantly, lowering cholesterol levels through diet, exercise, and medication is critical to prevent worsening blockages. Ignoring swollen legs and ankles as a natural part of aging can be a dangerous mistake. When walking consistently triggers or worsens swelling, it is the body's way of signaling that circulation is compromised. Listening to this signal and addressing cholesterol early can prevent more serious and even life-threatening cardiovascular problems down the road. One of the more alarming symptoms connected to dangerous cholesterol levels is the slow healing of sores or wounds on the feet. At first glance, it might not seem unusual if a blister from a tight shoe or a small cut takes time to heal. However, when the healing process drags on for weeks or even months, it becomes a sign that circulation may be compromised due to high cholesterol and arterial plaque buildup. The body's natural healing process depends on a steady supply of oxygen-rich blood to deliver nutrients, immune cells, and repair mechanisms to the injured tissue. When cholesterol clogs the arteries, blood flow to the lower extremities becomes restricted, slowing down or even preventing the proper healing of minor injuries. Walking often exposes the feet to friction, pressure, and small injuries, especially if footwear is not ideal. For people with high cholesterol, these everyday stresses become a bigger problem because the body cannot repair even small wounds efficiently. For instance, a blister caused by walking might not heal at all, eventually turning into an ulcer. These ulcers can become painful and prone to infection. Without proper circulation, antibiotics and other treatments may struggle to reach the affected tissue, further complicating the healing process. What begins as a minor inconvenience can spiral into a medical emergency if infections spread to deeper tissues or bones. This slow healing is often seen in conditions such as peripheral artery disease (PAD), which is directly tied to high cholesterol levels. PAD occurs when plaque builds up in the arteries that supply blood to the legs and feet. The result is insufficient circulation, which not only leads to leg pain and numbness during walking but also disrupts the body's ability to heal. In severe cases, non-healing sores can progress to gangrene, requiring surgical intervention or even amputation. Beyond the local damage, slow healing is also a systemic warning. If cholesterol is restricting blood flow to the feet, the same process is likely affecting the coronary arteries of the heart and the carotid arteries that supply blood to the brain. This dramatically raises the risk of heart attacks and strokes. Recognizing slow healing as a red flag is essential. Many people make the mistake of self-treating wounds on their feet without realizing the deeper cause of the problem. If a sore or cut shows no sign of improvement within a couple of weeks, medical attention should be sought immediately. Doctors can use vascular tests to determine the extent of blood flow restriction and recommend treatments such as cholesterol-lowering medications, procedures to open blocked arteries, or lifestyle changes to improve circulation. Preventive care also matters greatly. Keeping the feet clean, wearing proper shoes, and checking for injuries regularly can help minimize risks. However, the root of the issue always comes back to controlling cholesterol levels. Ignoring slow healing wounds is effectively ignoring a clear message from the body that something more serious is happening beneath the surface. Another often overlooked but significant symptom of high cholesterol during walking is fatigue and weakness in the legs. Many people interpret leg fatigue as a simple result of age, lack of exercise, or being out of shape. While those factors can play a role, persistent weakness or tiredness in the legs during walking can point to poor circulation caused by cholesterol-induced arterial blockages. Muscles rely heavily on oxygen and nutrients carried by the blood. During walking or other physical activity, the demand for these resources increases sharply. In healthy arteries, blood flow adjusts to meet this demand. However, when cholesterol has narrowed the arteries, the muscles cannot receive enough oxygen. The result is a sensation of fatigue, heaviness, or weakness that sets in much faster than expected. This weakness may appear as legs that tire easily after walking only a short distance, even if the individual is otherwise healthy. Sometimes, the legs may feel wobbly or unsteady, making it difficult to continue walking at a normal pace. Rest usually brings some relief, but the fatigue quickly returns once activity resumes. This stop-and-go cycle is another classic indicator of peripheral artery disease, which is strongly tied to cholesterol buildup. Unlike general tiredness, this type of fatigue is very specific to exertion and is directly linked to the body's inability to supply adequate blood to the working muscles. Over time, leg fatigue caused by poor circulation can significantly reduce a person's quality of life. Activities such as climbing stairs, going for walks, or even standing for long periods become more difficult. Many people unconsciously reduce their activity levels to avoid discomfort, but this lack of movement further weakens the muscles and worsens circulation. The danger here is twofold. On one hand, the legs themselves suffer from poor blood supply, which increases the risk of sores, infections, and mobility problems. On the other hand, the symptom reflects broader cardiovascular risks. The same narrowed arteries that limit blood flow to the legs are likely also affecting the heart and brain, raising the risk of life-threatening events like heart attacks and strokes. Leg weakness should never be brushed off as a normal part of aging without medical evaluation. If fatigue occurs consistently during walking and improves with rest, it points to an underlying vascular issue rather than simple muscle tiredness. Doctors can diagnose the condition through non-invasive tests and create treatment plans that focus on reducing cholesterol, improving circulation, and restoring mobility. Lifestyle changes such as quitting smoking, exercising under supervision, and eating a heart-healthy diet play a vital role in recovery. Ultimately, leg weakness during walking is the body's way of signaling that high cholesterol may be silently interfering with circulation. By paying attention to this warning and seeking treatment early, individuals can prevent further complications and protect both their mobility and their cardiovascular health. Ignoring this fatigue could mean missing a critical chance to address cholesterol before it leads to severe and irreversible consequences.